Good morning, Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. We have back with us today for Wellness Wednesday, or Oral Wellness Wednesday if you prefer, Dr. Sofian Sayfo of Uncommon Orthodontics. Welcome, Doc.
Morning.
I should say welcome back.
Yeah.
We always enjoy having you every Wednesday here, and we learn so much. And I know parents out there and younger adults always learn so much about what are some of the best practices for things like aligning my teeth. The timing I know is important on that too. Of course, everybody always wonders about costs. I wondered in my personal experience, even before I had braces put on, they talked about tooth extraction. Could you tell us just on average, how common is a tooth extraction needed to be part of that alignment process?
There's no statistics about when you need it or not. I usually address it case by case basis, but I would say it's 50% of the time.
Okay. And the different types of aligners, we have basically braces or aligners.
Yes.
The transparent ones like Invisalign and like that.
Yes. I mean, we have braces, which is fixed appliance. We call it fixed appliance or braces. It can be on the facial surface of the tooth, or it could be on the lingual surface of the tooth. For people who have who have a lot of focus on aesthetics and they don't want anything to show, you can put the braces on the lingual surface, inside, behind the tooth. It became kind of like a very rare right now with the aligners taking over as like the aesthetic option. Of course, you have the surgery option for severe cases or cases that moving the teeth alone is not going to fix the problem. But mainly, if you want to tell the patient what options you have, it's either braces or aligners.
And we've talked in previous segments about the pros and cons of just braces themselves. Risks is what I should present as a question, as we talked before about risks associated with fixed braces. If you could review for us just briefly what some of those risks are.
Yes. So just imagine this: the braces are fixed on your teeth, so there's no way around it. They are there until the treatment is done. First, you have to adjust to what you can eat. You cannot eat anything that can break those brackets, which is anything crunchy, hard, chewy. That's gonna get stuck between the brackets or behind the bracket and create some issues. Yeah, challenge you with cleaning them and keeping them keep your teeth clean. So that's one. The aesthetic, of course, is a challenge. Some people don't like it. Beside the middle school students or patients, they are the only one who are excited for the look of braces because it's trendy. The second they move, you will not believe it. The second they move to high school, it's gone. Now they hate it. Now they want to be out of it. They cannot tolerate it. All that kind of things. The feeling. Sometimes people hate the feeling of braces, especially if you have any kind of like a sensory issues, or just the feeling itself is irritating. But beside that, braces take away that kind of a lot of compliance that you need with aligners that we'll talk about in a second. Braces work; they work constantly. But if you care about aesthetics or the feeling or the hygiene, because it's very challenging to clean them, then your second choice is, or first choice, depends on the case, is aligners. Every cons with braces is fixed with aligners. They are more aesthetic. You almost don't see anything. You never tell the patient they are invisible, because they are not. You can tell that there's something there, especially with the small attachment that we put on the tooth. But they are very, very aesthetic. They are very hygienic, because you can brush your teeth normally, you can floss normally. There's no issues. There's nothing obstructing you. You just take it out and you brush and floss normally. And at the same time, you can eat whatever you want. Now, the problem with aligners is compliance. Now you face the problem with are you that person who can commit to schedule, do the right thing day in, day out for the length of the treatment, which sometimes takes 18 months or sometimes takes 2 years. Because just think about it this way. Aligners do not work in your pocket. They have to be on your teeth, and they have to be on your teeth constantly all the time. Minus, which is what proposed this challenge. If I tell you put something for the next 2 years, you probably will be able to do it. But if I tell you every single time you have to eat or drink anything beside water, now the first thing you think about, coffee? No. No. Anything you eat or anything you drink beside water, you have to take it out. finish your meal, finish your drink, and then brush your teeth or rinse your teeth if you're drinking something, and then put them back on. It's a system, and there's so many people they cannot adhere to that. We go back to high school patients. Good luck with that. Tell them like you have to do this, do that, do this at a regular time and specific kind of a regimen. Now the problem with that aligners, yes, you can eat whatever you want because it does not propose that kind of breakage problem, hygiene problem, but you cannot snack. Which is imagine you snack 10 times a day, which we've talked about last time. Average American people eat, in average, 15 times a day. Between snacking, sipping on stuff, eating, meals, stuff like this, about 15 times a day. So imagine you have to shrink that to 3 times. It's challenging. It's a whole diet on its own.
Is there any age that aligners or braces work best, Doc?
Let's say just first, I wanna touch on the case selection, because there's so many times that people come to me and is like, oh, my dentist told me I cannot do this with aligners. That's kind of like not very accurate. I tell my patients, between aligners and braces, it is not case by case. It's not how your teeth look. It's not the treatment itself. It's patient by patient. Meaning, if you are someone who is responsible, compliant, can follow these kind of systems and orders and adhere to them, aligners will work with you every day of the week. There are some offices now that have only aligners, 100% no braces. They can fix every single case. Trust me, they're not turning anybody around. They are fixing every single case with aligners. So it's possible. Now, are you compliant enough, responsible enough? That's the question.
Gotcha.
But it's not about, sorry to interrupt you, but it's not about age. It's not about case. It's not about your teeth. It can work. Actually, we can start even with primary teeth, baby teeth, age 8, 9. We still have some successful cases with younger patients just because they are responsible.
And with those aligners, the different ones, whether they're braces or aligners, I understand from talking to some of our listeners, one of the first concerns they have, of course, is cost. And is there a significant difference between the cost in aligners versus braces?
That depends on who's charging and the place in the office. But I would say with aligners, there is extra cost on the provider. Because aligners, the strength in aligners is not only by the physical aligner, it's the software behind it. So there's a company that owns that software and fabricates them for us. So we have to pay them a hefty lab bill, and it needs to somehow be reflected in the fees for the patient. I really don't know much about how much we charge the patient for or the finances of the treatment, but I would say the difference is very, very, very minimal.
For someone to come into Uncommon Orthodontics, Doc, for a consult, is there a charge for that consult for aligners?
Our consultation is complimentary for our patients. We take x-rays, photos, we talk to the patient, examine them, give them detailed, comprehensive image of their situation and the treatment that we suggest. And that's always complimentary no matter what.
What a great deal. And where do we find you?
We are on 2330 South Range Line, and you can find us on Facebook on Uncommon Ortho or uncommonortho.com.
Doc, as always, we thank you for being with us today. Next week, we're going to have some questions from our viewers, from our listeners to discuss, maybe even air live some of those as we're talking. So I'm looking forward to that.
Wonderful.
Thanks for being with us today.
Wait. Thank you. Appreciate it. Thank you.
Dr. Sofian Sayfo with Uncommon Orthodontics. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Thanks for watching.